Hello and welcome everybody to the Animal Eye Guy. Today we're going to talk about ocular tumours in animals. Now, ocular tumours is a big subject. It's a big topic, and that ranges from tumours which differ between dogs and cats, and it varies from tumours which are on the outside of the eye versus tumours which are on the actual eye or inside of the eye or behind the eye. But just to break it down a little bit, eyelid tumours in dogs are mostly benign. They're usually very small, so-called tarsal gland adenomas, or or even benign small melanomas, and can be relatively easily removed via surgery as long as they are of a certain size. Once those tumors become very big, and that's usually when they're about more than a third or um, sort of between a quarter and a third of the eyelid margin, it can become a little bit more tricky to remove them, but it's still not impossible. But by and large, eyelid tumours in dogs are mostly benign. There are some exceptions to the rule, so some types of mast cell tumours can be very challenging to treat. There are some forms of melanomas which can be very aggressive and very challenging to treat. But that's a very small percentage of dogs who have these types of tumours. In cats, this is very different. In cats, eyelid tumours can be a lot more aggressive. We tend to see a lot of so-called squamous cell carcinomas and other types of tumours on the eyelid in cats, which either are too big to operate, or even if they are operable, they can be more aggressive and they have a slightly higher chance of recurrence. Again, there are exceptions to this. You sometimes have cats with similarly benign eyelid tumours to dogs, but by and large, in cats, we tend to worry about this a lot more than we do in dogs.
This is a video of an eyelid mass that we're removing using a so-called wedge resection. So we're making an incision into the eyelid with a very small margin around the eyelid mass. And then this is in a sort of inverted house shape incision. And then we're removing this with scissors. We try to avoid damaging the eyelid margin as much as possible, because we're going to have to put this back together again, and the eyelid margin is what's going to keep the surfaces of the eyelid healthy. And then this is putting it back together again. This is using very small suture material, using a special suture pattern that will align the eyelid margin the way it was. These sutures don't have to be removed. They tend to break down within about 5-6 weeks after the operation. Wound should be healed in about 2 weeks, and they tend to go home on some painkillers, some antibiotic eye drops, some lubricating eye drops, and a head cone. There should be minimal swelling and bleeding after the operation, and we tend to have a very low recurrence rate. And this is after completion of the procedure.
Tumours on the surface of the eye, which includes tumours on the actual cornea, which is the transparent part of the eye, tumours of the sclera, which is the white bit, which is just adjacent to the cornea, are more variable. So we see certain types of tumours in dogs which have got a higher recurrence rate. So tumours such as hemangiomas or hemangiosarcomas, which tend to be extremely red looking lumps on the cornea. They can look very similar to so-called granulomas. So you oftentimes need a biopsy to be able to confirm that this is indeed a tumor. But these do tend to have a higher chance of recurrence, which means that they're more likely to come back. There are other types of tumors such as squamous cell carcinomas. Again, we tend to see those quite commonly or more commonly in cats than we do in dogs, but we can see it in both. Are also types of tumors where we're more worried about them coming back. Other types of tumors on the sclera and the so-called limbus, so the white bit of the eye and the junction between the white and the transparent part of the eye, are oftentimes melanomas, so they're kind of like little black lumps, which tend to be benign, but they can be challenging to remove. And if you miss the opportunity to remove them while they're still operable, you might have to sacrifice the eye in order to get rid of the tumor. The way that we usually remove tumors on the cornea or on the sclera, again, involves surgery. Now, this tends to be a slightly more delicate and intricate procedure than eyelid mass removals. So we usually have to take very, very sharp blades and an operating microscope to dissect that very, very thin structure. So the cornea is about 0.5 mm thin. If you start having to take away a third or half of that thickness to remove the tumor, then you have to be very careful that you don't penetrate all the way through the eye, which could lead to catastrophic problems for the eye, and then the eye may need to be removed as a result of that.
Now this is a corneal mass, turned out to be a so-called hemangioma or hemangiosarcoma. We're starting this procedure by dissecting the layer of blood vessels around that tumor, and now we're cutting into the cornea using a very, very delicate and very sharp blade. All of this is done under the operating microscope. We're now dissecting them. They tend to be quite bleedy, which is not unusual, and we're trying to dissect that mass as with clear margins as we can, going quite deep. There's more bleeding here, and now the mass has been removed. And now we're going to use a so-called cautery unit to try and stop the bleeding, and we're pretty much cauterizing that whole wound bed. This will also kill off some of the remaining tumor cells. And now this is a so-called cryo treatment where we were using very, very cold temperatures to kill off any remaining tumor cells. And now we're placing a graft of conjunctiva over the top of the cornea, just to fill in that defect. We've done quite a deep incision here, and this will also aid in the wound healing process, and this patient had a good outcome.
And finally, the tumors which are inside of the eye or even behind the eye. So tumors which are inside the eye in cats tend to be more malignant, so they tend to be bad most of the time. And in order to treat them, we oftentimes have to sacrifice the whole globe to try and prevent it from spreading either to the other eye or to other parts of the body. These types of tumors are usually so-called diffuse iris melanomas, or we sometimes see so-called lymphomas, or adenomas or adenocarcinomas of the structure which is behind the iris, which is the colorful part of the eye. In dogs, most tumors, even the ones which are inside of the eye, and that can be melanomas or the benign form, we tend to call those melanocytomas, as well as adenomas of the so-called ciliary body, which is on the back part of the iris, so the colorful structure of the eye, tend to be more benign, so they're less likely to spread to other parts of the body, and they're less likely to spread to the other eye. However, if you leave them for too long, they can start destroying the eye, causing pressure problems, so-called glaucoma, and that can lead to loss of the eye over the long run. Tumours in dogs, we try to treat using some sort of procedure. So there are some types of iris melanocytomas that we use lasers to try and get rid of. When I say get rid of, we basically burn them to try and kill off all the tumor cells. The benefit of that is it's a very non-invasive procedure, so there aren't any sutures involved, there's no cone involved. It's a procedure which can be performed under anesthetic in usually half an hour to 45 minutes. And although there are still complications or risks of complications, it tends to be a very non-invasive procedure.
This is a video of an iris laser. As you can see on the right, we're using a headset and a condensing lens, so it's a very non-invasive procedure.
More invasive procedures include procedures such as iridectomies, where you surgically resect part of the iris as well as the tumor, or so-called cycloiridectomies, where you remove the base of the iris and part of the iris, including the tumor. These are very, very delicate and intricate procedures with a higher complication rate because these tumors tend to be very vascular, which means they're very blood filled. The eye can bleed quite significantly. This can result in conditions such as retinal detachment or glaucoma, or in cataract formation. They can be very successful, but there is a chance that we could encounter problems along the way. But if the priority is to try and maintain the eye and try to get rid of the tumor, it tends to be a very good way of getting a diagnosis, but also trying to get rid of the tumor.
So this is an iris biopsy in a cat, which we suspected had an iris tumor, so-called melanoma, or perhaps a feline diffuse iris melanoma. And we're taking this biopsy both for diagnostic purposes, but also hoping to get rid of the primary tumor and avoid any recurrences. Now, this unfortunately was diagnosed as a feline diffuse iris melanoma, and about 6 months later, there were other satellite tumors which popped up in other areas of the iris, and this eye eventually had to be removed. But the short-term outcome after the operation was very successful, so the eye did really well. Unfortunately, based on the diagnosis, the eye had to be removed in the long run. And here we're removing the second part of this iris mass. So there's some left over here. We're just going in with some very, very delicate scissors to cut out the rest of this tumor. These procedures can bleed. This is still a fairly minimal amount of bleeding on the inside of the eye. So this is a fairly straightforward procedure. Now we're pulling that final piece of iris tissue out before closing up the wound. So this is a even more invasive procedure. This is a so-called ciliary body adenoma. As you can see, there's a little lump poking out from underneath the iris. And we're starting this procedure by cutting that very thin layer of blood vessels from the white of the eye. We're now using a very, very sharp blade to cut into the white of the eye. As you can see, there's lots and lots of blood vessels, so it's a very vascular structure here. As you can see, more bleeding, and that just makes the whole operation quite challenging. And we're now using a combination of various blades and so-called cautery to open up that area on the inside. So this is the cautery unit. We're trying to stop some of that bleeding. And here we can see this black bit is the so-called choroid, which is actually the first bit of the inside of the eye. It's a very, very vascular structure. And we have to open a window big enough to get access to the tumor. Again, now we're coagulating some of these blood vessels to try and minimize the bleeding. And here we've opened up a small hole into the choroid, and voila, that tumor is starting to poke out its head, and here comes the whole mass. So this is a very, very satisfying mass to remove. Again, quite a lot of bleeding here, which is not unusual. This eye will be quite full of blood even shortly after the operation. There is a risk that this could result in some pressure problems after the operation, so these patients have to go home on pressure medications at the same time, as well as some anti-inflammatory medications. And we're now using very, very delicate suture material to put the flap of the sclera, so the white of the eye, back together again. And then this is towards the completion of the procedure. So
Tumors behind the eye, so in the so-called orbit, they tend to be more difficult to sort out because you've got the eye in the way. And oftentimes, by the time the tumor is diagnosed, it tends to have be of a considerable size, and that can make um, sparing the eye or maintaining the eye very, very difficult. In cats with so-called orbital tumors, we're quite worried about those because they tend to be malignant or tend to be quite bad in most cases, which means that they can invade the bone. They can go along the nerve which connects the eye to the brain. They can go into the brain. They can go down the other side and into the other eye. So they can be quite aggressive and very difficult to sort out. And because the cat skull is so small and the distance between the orbit and the brain is very, very short, in some cases that they can be inoperable at the time of diagnosis, and we might not be able to remove the tumor with any safety margin. In dogs, it can go either way. Dogs can have quite bad and aggressive tumors, which might have invaded bone, or they can have very solitary, benign type of tumors, which will push the eye further forward and can lead to blindness at some point. But some of, or most of them don't tend to be life-threatening for the patient. But in the process of trying to remove that tumor, you may need to perform a larger surgery, such as a so-called orbitotomy or an orbitectomy, or in some cases you may have to sacrifice the eye in order to get access to the tumor and remove the tumor completely.
this is a patient with a tumor behind the eye. It's quite big, pushing the whole eye, as well as all the adjacent structures forward. We did some CT scan examinations to work out how badly this patient was affected, but it was decided that this eye needed to be removed in the process of getting rid of the tumors. This stage of the procedure here, we're in the process of removing the eye, as well as the eyelid and all the tissue surrounding it, before we can get access to the actual tumor. And again, because this tumor is very, very vascular, it's quite a bleedy procedure. So this eye is now almost out. And then here you can see the tumor just behind the eye. So we're removing all of that, cutting everything down to the bone, trying to get rid of everything here. And in some cases, you can get reasonable surgical margins. So in some cases you can get rid of the tumor permanently. Unfortunately, there are some cases where the only thing you can do is debulk or as much of the tumor as you possibly can. But there is a chance that the tumor could recur, but you've bought the patient a lot of time. And in cases, if you have an older patient, sometimes that's all you need to get them comfortable. So this is after removing all of the tumor. We're now closing the eyelid back up again, doing that in several layers. It will be a bit bleedy until the end of the procedure, but in most cases, once this wound is watertight, should be okay. And as you can see, this is sort of towards the end of suturing up the eyelid, and this is not looking too bad anymore.
So hopefully this has given you an overview over ocular tumours and what they entail. If there are any questions or comments, please put them down below, and I'll see you next time. Thank you. Bye-bye.